Okay, so imagine this. You need a heart valve replacement, but instead of like major surgery, you get a procedure that's like as easy as a stent.
Right.
Shorter recovery time, back to your life faster.
Yeah.
That's the kind of game changer that transcatheter heart valve technology is bringing to the table.
Exactly.
And today, we are going to do a deep dive into one that's making some serious waves. The Myval transcatheter heart valve.
Okay.
A huge thanks to the London Heartbeats Z Academy in the UK for the awesome research they provided.
Yeah.
And hey, if you are loving this deep dive into cutting-edge heart tech, make sure you're subscribed to us on Facebook, Instagram, Spotify, and YouTube.
Right.
So you never miss out on these fascinating discussions.
Absolutely.
So let's break this down for our listeners.
Okay.
What exactly is transcatheter aortic valve implantation, or TVI?
Right.
And why should they care?
So TVI is like a heart valve replacement, but it's minimally invasive. Think of it as a valve replacement without open heart surgery.
Gotcha.
That's a game changer, especially for people who might be too high risk for that traditional surgery.
So it's all about improving quality of life, right? Getting people back on their feet faster.
Absolutely.
Okay.
And there are different types of TVI, each with their own pros and cons. We've got balloon-expandable valves called BVs.
Okay.
And then there are self-expanding valves, or SEVs.
Gotcha.
Today we're going to focus on a BV called Myval.
Okay.
Which has shown some really interesting advantages.
And here's where it gets really interesting for our listeners.
Okay.
Research suggests that BEVs like Myval might actually lower the risk of complications, especially something called paravalvular leak.
Right.
This is where blood leaks around the valve, which you definitely don't want.
Right.
This is especially important for those high-risk patients we were talking about.
Absolutely. Minimizing leaks is vital for long-term success. And that's where Myval's unique design comes in.
Gotcha.
It's made by an Indian company, Myval Life Sciences, and they've incorporated a hybrid honeycomb structure.
Okay.
It has both open and closed cells, which creates a stronger, more secure seal.
And they didn't stop there.
Right.
It also has a special PEET sealing cuff to further reduce leakage.
Yes.
They've really gone above and beyond to make this valve as leak-proof as possible.
Exactly. What's also impressive is the range of sizes available.
Okay.
Myval comes in conventional sizes, intermediate, and even extra large sizes, giving doctors a lot of flexibility to choose the absolute best fit for each patient.
It's like a custom-tailored suit for your heart. And speaking of innovation, they've just released a new version, the Myval Octacore THV. What's the scoop on that?
This new version takes leak reduction to the next level.
Okay.
So imagine an octagon. That's the shape of the cells in this valve. And there's an external skirt, too. All these features work together to make sure that valve is snug and secure.
Okay.
Plus, they've introduced a technique called Octalign, which helps doctors precisely align the valve with the patient's own aortic valve.
So less chance of things going wrong during and after the procedure.
Exactly.
It's all about precision.
Yeah.
But before we dive into the clinical trials, I'm curious, how did Myval perform in those early preclinical tests?
You know, those early tests are crucial. They put Myval through some serious stress tests, simulating years of wear and tear, and the results really promising. They even did animal studies, and there weren't any deaths related to the device.
That's reassuring.
Yeah.
Okay, let's talk about when they first tried this valve out in humans.
Okay.
That was the Myval 1 study, right?
Right. This study took place in India with 30 patients.
Okay. All
All of them were considered high or intermediate risk for traditional open heart surgery.
Right.
And the results were amazing.
Yeah.
They had 100% device success rate.
Wow.
Significant improvements in the patient's quality of life, and minimal complications.
That's fantastic.
It was a really good first step.
But how does Myval stack up against the big names in the TVI world?
Yeah.
Valves like SAPIEN 3 and Evolut R. Our listeners are probably wondering how it compares.
There have been several studies comparing Myval to these more established valves. For example, one study followed over 1,000 patients.
Wow.
What they found was those who received a Myval valve were less likely to need a permanent pacemaker compared to those who got a SAPIEN 3.
If any of our listeners are thinking about getting a TAVI procedure, this is huge.
Right.
Needing a pacemaker afterwards means more procedures, a longer recovery, not fun.
Exactly.
Myval seems to be scoring points here.
I agree. It's a significant advantage. And another study, the EVR registry, showed that Myval had fewer cases of moderate or severe paravalvular leak compared to the Evolut R valve.
Gotcha.
And this was true at both 30 days and 6 months after the procedure.
So consistency is key.
Yes.
Okay, let's get specific.
Okay.
We know there are different types of patients who might need a TVI. First up, what about patients with conduction disturbances?
As we touched on earlier, research shows that Myval is linked to a lower rate of needing a permanent pacemaker in these patients compared to other THVs.
Gotcha.
That's a big win, especially for this group.
Makes you wonder if other valve manufacturers are taking notes.
Right.
All right, what about people who are considered low risk for traditional surgery?
Okay.
Is Myval a good option for them too?
It seems so.
Okay.
A study with 100 low-risk patients across 9 different European centers found that Myval had a 99% procedural success rate.
That's impressive.
And very few complications.
And speaking of impressive, how is Myval performing in patients with bicuspid aortic valve stenosis?
Okay.
This is a condition that makes TVI a bit trickier, right?
It does.
Okay.
But even with this added challenge, several studies have shown that Myval is both safe and effective for these patients.
Okay.
One study even found that it performed better than the SAPIEN 3 Ultra and Evolut PRO Plus valves.
Wow.
When it came to device success.
Okay, now I'm really curious. What about patients with non-calcified aortic regurgitation?
Right.
Can Myval help them too?
That's a tough one.
Okay.
Non-calcified aortic regurgitation is a bit of an unusual case in the TVI world.
Right.
And many valves just aren't designed for it. But because Myval comes in a wider range of sizes, it might be a good option.
Okay.
There was one study that had some promising midterm results, but we definitely need more research on this front.
It sounds like Myval is really pushing the envelope and opening up possibilities for patients who may not have had many options before.
Right, yeah.
Now, we've been talking a lot about how the size of the valve is important for a good fit, but is there more to it than that?
You're right. Size isn't everything.
Yeah.
There's also a newer approach called perimeter sizing.
Okay.
Research suggests that this method, when used with Myval, leads to good outcomes for the patient.
Okay.
Fewer pacemakers, needed no major leaks, and overall good clinical results.
So another tool in the doctor's toolkit.
Exactly.
Now let's switch gears for a second.
Okay.
What about something called dysfunctional stenosed RVOT conduits?
Okay.
Where does Myval fit into that picture?
Remember how we talked about Myval being versatile?
Yeah.
Well, it's been used successfully in patients with these specific conduits, particularly after they've had procedures to correct congenital heart defects.
Right.
One study showed that doing a pre-stenting followed by Myval implantation led to big improvements for these patients.
So it's not just a one-trick pony.
Right.
Now, this next one is for our listeners who are really following along closely.
Okay.
We've talked about LVADs, or left ventricular assist devices, before on the show.
Right.
But what about TAVI for aortic regurgitation in patients who already have an LVAD?
Right.
That seems like a complicated scenario.
It is complex, but Myval's largest size, that 32-millimeter valve we talked about, has shown some real promise here.
Okay.
It's been used successfully to treat aortic regurgitation in LVAD patients, especially those who need a larger valve than usual.
Myval really seems to be a problem solver for some of the toughest cases.
Yeah.
Now, we know that TAVI isn't a one-size-fits-all procedure. It's usually done through the femoral artery in the groin.
Right.
But what if that's not an option for the patient?
Good point.
Okay.
Some people have peripheral vascular disease, which makes the femoral approach difficult or impossible. But the great thing about Myval is that it can be implanted in other ways, like through the transcarotid or transaxillary routes. And studies show it's successful this way, too.
I love how this is all about options for the patient.
Exactly.
Speaking of options, let's talk about in-valve procedures, also known as VV.
Right.
This is where a new valve is implanted inside an older valve that's no longer working properly.
Right.
Have they tried this with Myval?
They have,
How
and
come?
it's been quite successful.
Good.
Myval has been used effectively in both aortic and mitral VV procedures.
Okay.
Studies have shown high success rates, low mortality rates, and very few complications.
Wow.
It's a valuable tool for those patients who need a new valve after a previous procedure didn't work out as planned.
It's like a second chance at a healthy heart.
Exactly.
We've talked about Myval and mitral VV procedures. But what about tricuspid VV?
Right.
Is that on the table too?
It's definitely being explored. Okay.
Doctors are starting to use Myval for tricuspid VV, and early experiences suggest that it's safe and feasible.
Good.
The wide range of sources is particularly helpful in these cases, as it allows for a really precise fit and reduces the risk of complications.
It seems like Myval is constantly pushing the boundaries of what's possible in TVI.
Yeah, it really is.
Before we move on, quick reminder to our listeners, if you're enjoying all this cutting-edge heart knowledge, hit that subscribe button and follow us on Facebook, Instagram, Spotify, and YouTube for more deep dives like this one.
Absolutely.
Now back to Myval, are there any patient groups where it's still being studied? Where the jury's still out on how well it works?
Yes.
Okay.
One group that comes to mind is patients who have both aortic stenosis and cardiac amyloidosis.
Okay.
This is a tough condition where abnormal proteins build up in the heart muscle, making valve implantation more complex.
Gotcha. We need more research to fully understand how Myval performs in this specific group.
So even with all its versatility, there's still some areas where we need more data.
Absolutely.
Makes sense.
Yeah.
Now, I want to circle back to something we touched on earlier.
Okay.
Those extra large sizes that Myval offers. Why are they such a big deal?
Those larger sizes, the 30.5 millimeter and 32 millimeter valves, are specifically designed for patients with larger aortic annuli.
Okay.
Basically, the opening where the valve sits with other valves.
Yeah.
Doctors sometimes have to expand a smaller valve to make it fit.
Okay.
But that can cause problems down the road, affecting how long the valve lasts and how well it works.
Gotcha.
Myval's larger sizes eliminate that issue.
So it's all about getting the right fit.
Yeah.
Right from the start.
Right from the start.
How is that 32 millimeter Myval performing in real-world scenarios?
A recent study looked at 10 patients with very large aortic annuli who received the 32 millimeter Myval. The results were fantastic.
Yeah.
Every single patient had a successful procedure.
Wow.
And no complications related to the device.
That's incredible.
This is big news for patients who might have been told they weren't eligible for TAVI in the past because of their anatomy.
What about patients with large bicuspid anatomy?
Okay.
We know that can be a challenging situation.
We're still collecting data on that.
Okay.
But early results are promising.
Yeah.
There was a case series involving 3 patients with severe bicuspid aortic stenosis who were treated with the 32 millimeter Myval. They had great outcomes, both clinically and in terms of blood flow.
Okay.
So more research is needed, but it's definitely looking like a valuable tool for these complex cases.
Before we wrap up this part of our deep dive, let's take a step back for our listeners who are just tuning in.
Yeah.
What are the key things they should remember about the Myval transcatheter heart valve?
Right.
What really sets it apart?
For me, it's the combination of those unique sizes.
Okay.
Especially the intermediate and extra large options.
Right.
And the innovative design features like that hybrid honeycomb structure and the PE sealing cuff.
Okay.
They've really thought of everything to make this valve fit precisely, minimize leaks, and get the best possible outcome for the patient.
And don't forget the delivery system.
Yeah.
The Navigator THV. It's designed to make the procedure smoother and more controlled for the doctor.
Right.
Which is great news for everyone involved.
Yes.
But of course, we have to be honest here.
Right.
There are still some gaps in the research, especially when it comes to how long these valves last.
That's true.
Yeah.
The short-term data is encouraging, but we need longer-term studies to really see how Myval performs over several years.
Exactly.
That's the gold standard.
And that's where the Landmark trial comes in, right?
You got it.
Okay.
Landmark is a big, ongoing study that's comparing Myval head-to-head with other top-tier THVs from the SAPIEN and Evolute series.
Gotcha.
Early results suggest that Myval is just as good as these established valves in terms of safety and effectiveness at 30 days.
That's big news.
Yeah.
The Landmark trial could really change the game and cement Myval's place as a leading TAVI device.
Yeah.
But we're not done yet.
Okay.
We'll be back in a moment to dive deeper into the landmark trial and explore what the future holds for Myval and transcatheter heart valve technology in general.
Great.
And one last reminder before we go. If you want to stay up to date on all the latest developments in heart health, make sure you subscribe to our channels on Facebook, Instagram, Spotify, and YouTube.
Absolutely.
We'll be back after a quick message.
Sounds good. Welcome back to our deep dive into the Myval transcatheter heart valve.
Okay.
We were just discussing the landmark trial, which is causing quite a stir in the cardiology world.
It is a major study for sure. It's like a head-to-head matchup between Myval and some of the biggest names in TAVI.
Exactly.
So what have we learned so far?
So the landmark trial enrolled 768 patients.
Okay.
And randomly assigned them to receive either the Myval or a contemporary THV from either the Sapien or Evolut families.
Gotcha.
The main goal was to see how safe and effective each valve was at 30 days.
Okay.
And guess what? Myval was just as good as the other valves.
So it's holding its own against the heavy hitters?
Yeah.
That's impressive for a newer device.
Absolutely.
Okay.
And there were some other interesting findings.
Okay, like what?
For example, the need for post-dilation, that's a technique used to fine-tune the valve after it's implanted, was significantly lower in the Myval group.
So that could mean shorter procedure times?
Exactly.
Less time under anesthesia?
Yeah.
Fewer complications? All good things for the patient?
All good things.
Okay.
And when they looked at the hemodynamic performance of the valves, things like pressure gradients and effective orifice area, which basically tells us how well the valve is working in terms of blood flow.
Yeah.
Both Myval and the other valves showed significant improvements from before the procedure to 30 days out. So everyone's getting a good result in the end.
It seems so.
Okay, so Landmark is giving us a lot to be optimistic about.
Yeah.
But as with any new technology, there are always questions and areas where we need more information.
Right.
Our listeners are smart folks, so they're probably talking about this too.
You're absolutely right.
Okay.
One of the biggest questions is long-term durability.
Right, because a heart valve's a big deal.
Yeah.
You want to know it's going to last.
Exactly.
Okay.
The 30-day data from Landmark is great, but we need to follow these patients for years to see how Myval holds up over time.
Okay.
Another area for more research is the impact of Myval's intermediate sizes.
Right.
We know they offer a more customized approach to valve selection.
Okay.
But we need more data to confirm that this really translates into better outcomes for patients.
It's all about fine-tuning our understanding of how this technology works in different people.
Exactly.
Okay, let's shift gears for a moment.
Okay.
And talk about something that's really important to our listeners. Access to care.
Yeah.
And affordability.
Right.
New medical technologies can be expensive. So how does Myval fit into that picture?
That's a crucial point.
Okay.
Myval is manufactured in India.
Right.
Which has a reputation for producing high-quality medical devices at a lower cost.
Okay.
This could be a real game changer for making TAVI more affordable and accessible to people all over the world.
Especially in places where resources are limited. That's really exciting to think about.
Yeah, it is.
So Myval is showing a lot of promise.
It is.
So we need more research.
Right.
But let's be real.
Okay.
Are there any downsides or limitations to the Myval valve?
Well, like any medical procedure,
there are potential risks and complications associated with Myval implantation.
Okay, like what?
These can include leading stroke, vascular injury, and the need for a permanent pacemaker.
So it's really important for patients to have an open and honest conversation with their doctor about the risks and benefits of TAVI
Absolutely.
Before making any decisions.
Informed consent is everything.
And it's worth repeating that while Myval has shown excellent results in a variety of situations, the long-term data is still limited.
Yes.
Especially for the newer models and the larger sizes.
Exactly.
Okay.
Ongoing research and careful monitoring of patients are essential to fully understand how Myval performs over the long haul.
And there's another trial, the TAVI trial, that's comparing Myval to the Sapien valve.
Right.
More data is always a good thing.
Right? Absolutely. The more information we have, the better equipped doctors will be to make the best choices for their patients.
Okay, I want to circle back to something you mentioned earlier. The possibility that Myval could make TAVI more affordable and accessible globally.
Right.
Can you tell us more about that?
Sure.
Right.
The fact that Myval is made in India, where they have a lot of expertise in producing high-quality medical devices at a lower cost, has the potential to disrupt the TAVI market.
Right.
This could really shake things up and make this life-saving procedure available to many more people.
Breaking down barriers to care, that's something I think we can all get behind.
It's definitely something to be excited about. And it's not just Myval.
Okay.
Researchers around the world are constantly working to develop new materials, designs, and delivery systems to make TAVI even safer, more effective, and less invasive.
That's great news for anyone facing a heart valve replacement.
It is.
So looking ahead, what do you think the future holds for patients with heart valve disease?
I am optimistic.
Okay.
I think we're on the cusp of a new era in cardiac care.
Okay.
With the advancements we're seeing in transcatheter heart valve technology, I believe we'll see even less invasive procedures with shorter recovery times, valves that last longer and are more resistant to wear and tear, personalized valve selection based on each patient's unique anatomy and risk factors.
Okay.
And expanded treatment options for patients who might not have been eligible for TVI before.
Wow, that's a lot to look forward to.
It is.
It sounds like the future of heart care is in good hands.
I think so.
But before we get too carried away with the future, we want to remind our listeners that if you're enjoying this deep dive into Myval and the world of TVI, be sure to subscribe to our channels on Facebook, Instagram, Spotify, and YouTube.
We love having you as part of our community.
Now, back to the Myval.
Okay.
We've talked a lot about the clinical trials and the potential benefits. But before we wrap up this episode, I'd love to get your take on what you find most remarkable about this technology.
For me, it's the ingenuity of the design.
Okay.
The hybrid honeycomb structure, petite sealing cuff, the range of sizes, and the intuitive delivery system. It's like they took all the challenges of TVI and addressed them head on with a focus on making the procedure as safe and effective as possible.
It's really a testament to the power of innovation and the dedication of the researchers and engineers who are constantly pushing the boundaries of what's possible in medicine.
I couldn't agree more.
Okay.
And I think it's important to acknowledge the role of companies like Myval Life Sciences who are investing in research and development to bring these innovative technologies to market.
They're playing a vital role in shaping the future of heart care.
They are.
Now, I know we've covered a lot of ground today.
We have.
But is there anything else you think our listeners should keep in mind about the Myval valve as we wrap up?
I think the most important takeaway is that Myval is a promising new option for people with heart valve disease.
Right.
And it has the potential to change the way we approach TVI. The early results are encouraging, but we need to stay tuned for those long-term data to get the full picture.
That's a great point.
Yeah.
Science is an ongoing process, and we're always learning more.
Absolutely.
But for now, it seems like Myval is giving a lot of people hope and a chance at a healthier future.
And that's what it's all about.
We'll be back after a quick message to finish up our deep dive on the Myval valve. Don't go anywhere. Welcome back to the deep dive. We've been taking a really close look at the Myval transcatheter heart valve, and there's just so much to unpack.
Yeah, it's a fascinating technology and one that holds so much promise for the future of cardiac care.
Before we wrap things up, there are a few points I wanted to circle back to, things that really stood out to me as we were going through all this research.
Okay, I'm all ears. What piqued your interest?
Well, one thing that really impressed me was the level of precision they've achieved with the Myval octacore. Specifically, that whole concept of commissural alignment and the octaline technique.
Yeah, it's a remarkable achievement. Getting the valve aligned correctly is so important for it to function properly and for it to last as long as possible. And the fact that they've developed a technique that allows for such precise alignment without the need for extra equipment or software, that's really innovative.
They've really gone the extra mile to make this valve as user-friendly and patient-friendly as possible.
And it's not just about the technology itself, it's about the impact it has on people's lives. We've talked about all the positive results in different patient groups, but I think it's important to emphasize that Myval is giving hope to people who might have thought they were out of options.
Absolutely. We've talked about patients with larger aortic annuli bicuspid valve anatomy and even those dysfunctional RVOT conduits. Myval is opening doors for these patients and offering them a chance at a better quality of life.
And let's not forget the potential impact on patients with peripheral vascular disease who might not be able to have a traditional TVI procedure. The fact that Myval can be implanted through alternative routes like the transcarotid or transaxillary approaches, that's a game changer.
It really is breaking down barriers to care. It's like a beacon of hope for patients who might have felt like they were running out of time.
And that's what makes this field so rewarding, seeing firsthand how these advances in technology can translate into real, tangible benefits for patients. It's truly inspiring.
It's an honor to be able to share these stories with our listeners and help them understand the possibilities that are out there.
And speaking of possibilities, I'm excited to see where Myval and transcatheter heart valve technology go from here. With ongoing research and development, I think we're just scratching the surface of what's possible.
I completely agree. We're on the brink of a revolution in how we treat heart valve disease. And with companies like Myval Life Sciences pushing the envelope, the future looks incredibly bright.
So as we wrap up this deep dive, what's your main takeaway message for our listeners? What do you want them to walk away with?
For me, it's the realization that the Myval transcatheter heart valve is more than just a medical device. It represents hope, innovation, and the relentless pursuit of better outcomes for patients. And while we still need more long-term data to get the complete picture, the early results are incredibly encouraging.
Well said. That's a perfect way to sum it up.
And on that note, I want to thank our listeners for joining us on this deep dive into the world of the Myval transcatheter heart valve.
We hope you found it informative and engaging.
Before we sign off, a huge thank you once again to the London Heartbeat Z Academy for providing all of the incredible research that made this episode possible.
Absolutely. Their dedication to advancing our understanding of cardiovascular disease is truly commendable.
And of course, if you're as fascinated by this technology as we are, don't wait to check out the show notes for links to all the studies we've discussed. And for even more deep dives into the world of heart health, make sure you subscribe to our channels on Facebook, Instagram, Spotify, and YouTube.
We'll be back soon with more cutting-edge research and insights.
Until then, stay curious, stay informed, and most importantly, stay heart healthy.